Now, why I am trying to tell you, you follow your histology portion of that Vishram Singh, Indrapreet Singh, Datta or Chaurazia, everything. You just follow this part. Competency-based undergraduate curriculum AN 65.2 describe the ultrastructure of epithelium. You have written, you have studied in 12th class science the cell. And what are the ultrastructures are there? These are already you are knowledgeable. You are knowing it, expected. Okay. Now types of tissue: epithelium tissue, nervous tissue, muscular tissue, connective tissue. These are the tissues, the main 4 tissues component of the human body. Now today I have just give you a glimpse of your muscular tissue, but I have covered most of it. But ultrastructural description of your, it's not in the theory or something, but you go through it. But now today we will be speaking on epithelium tissue. Now epithelium, now surface of the body, inner and outer, and inner surfaces of the tubular structures within the body are covered by a layer of cells that rests on the basement membrane, such as covering layer is called epithelium. Epithelium is a basic tissue body that consists of tightly adherent cells called epithelial cells. That describes it. Which is the largest organ of the human body? Skin. Now, skin, they say, in Bengali we have a term, Gondaret chamra. This means rhinoceros. Skin. Gondaret chamra. That it happens. You abuse me, you say anything, you pull my hair. I'm least bothered. But আমার চামড়াটা গন্ডারের মতো। ঠিক আছে? Now, similarly, one thing I tell you, but human epithelium, human skin is totally different. Now, epithelium is the basic tissue of the body and consists tightly adhered cells called epithelial cells. Yesterday I drew this. This is stomach, and the muscular layer of the stomach is there. Now it's covered by epithelium, gastric epithelium. Now in different areas, different cells are there. Now gastric epithelium is layered. It secretes mucus, it secretes acids, all these cells. That's why your food, your kebab, your some nice ice cream, all things they bear. একটা whiskey খেলাম, একটা peg, whiskey খেলাম, তার সঙ্গে একটা kebab খেলাম. See, what I'm telling is that it is so much resist. মানে the food components, I'm just telling you, give you an example, how much trauma it acquires. দেখো একটা party হচ্ছে, একটা ছেলে without soda or without any water, he gulps in. Okay, this goes down, but by the time it's traveling, stomach অতটা affect করতে পারে না through the esophagus and this thing. It is burning. It is torturing denaturing the cells, and that is the epithelial cells. Now, features of epithelium. Epithelium consists of layers of cells that cover body surfaces. Epithelium is a avascular structure. It receives nutrition by diffusion. See, this is the viva. Epithelium diffusion. It doesn't have, each cell doesn't have a vascular supply. Now, see, this is the artery, gastric artery. Okay. Now, this, whatever component this supplies, this is the epithelium, this layer. So, it does not supply like this. It does not supply like this. See how nature is this. Some millions of cells are there. Now, millions of arteries, capillaries don't supply, but by diffusion. Okay. Now, epithelial cells rest on the basement membrane. Now, so it does not supply the, now this is the epithelial basement membrane. Now, why I am telling you that you have to know anatomy in the sense that in what is pathology? It's the deviation of the normal anatomy. So, if there is a layer of cells, suddenly some denatured, some pathological condition, it might be acute inflammation, gastritis. It can be your malignancy, means cancer. So, the total anatomy is distorted. Epithelial cells isolate deeper structures from surface environment. Epithelial cells show surface modification as per functional need. For example, microvilli in the intestine increase absorptive areas. Now, this is the intestine. I am saying this is the intestine. Now, intestine is this. It is like this. This is the epithelium. This is the muscular layer. Okay. Now, this epithelium is like this. Now, microvilli is like this. Now, microvilli is like this. Microvilli. And because see, now, if you go to the parlor, now your hair is straight. Now you want to curl, and they take that heat and it's keratin. Actually, it gives an effect like that. Like this. It's the front part. Now, the street 12 inches. Now, if that is curved. Now, similarly, the intestine's microvilli is like this. So, if you make that microvilli flatten, just imagine, I'm saying, I'm discussing. বুঝতে পারলাম? Can you understand? কি ভাবছিস বলতো? What are you thinking? মন খারাপ? তাহলে মায়ের জন্য? মন খারাপ ছেড়ে দে। ক্লাসে মন খারাপ করবি না। তোর বয়ফ্রেন্ডরা যদি ইয়ে করে থাকে মন খারাপ করবি না। তাকে বলবি I am busy now, I will talk to you later. Politely বলবি, ঝগড়া করবি না। হ্যাঁ, কারণ তোকে আবার ঝগড়া করলে you have to break the silence. Okay. Now see, epithelial cells undergo mitosis and can regenerate damaged portion. That's what I told you. Now see, the party you went to, the next 7 days you have burning sensation and belching, irritability is there. What we recommend? You recommend a bland diet, all boiled. Okay, and some antacids and PPI. PPI means proton pump inhibitors. This Rantac, Gintac, all this, omeprazole, raprazole, esomeprazole, these drugs, and plenty of water to drink. Then that soothes. And similarly, there's mitosis of cells, and that region is revived. But if you go repeatedly, then there will be chronic ulcer. And more this thing tortured, it goes precancerous or cancerous. Okay? Now that is, I'm just to stress that how it degenerates, what are the factors in this thing. Now, functions of epithelium. What are the functions? Now, each organ is lined by the epithelium. So, epithelium lining the ureter, kidney or lung, it has their different functions. Okay. Now, epithelial cells perform various functions based on their location, where there is location. Protection protects deeper structures. For example, in the skin, epithelium called epidermis protects deeper structures from the external environment. Barrier, mechanical barrier and may permit selective substances to cross it. For example, epidermis prevents entry of viruses but allows the entry of some lipid-soluble drugs, ointments. Absorption, for example, in the intestine, epithelium absorbs nutrients from digested food. Secretion or excretion, for example, in salivary gland, epithelium is involved in saliva secretion. Sensory perception receives sensory signals from the external environment. For example, epithelium of the tongue, taste buds are involved in the perception of taste sensation. Now you just take any food, hot food. Suddenly you get, oof, dal. Now that is having a perception imposed immediately. Now epithelial cells have different size and shapes according to their location and need for their functions. The epithelial cells have three basic types: squamous, flat, cuboidal, and columnar. Squamous, cuboidal, and columnar. Section: epithelial cells may be squamous, cuboidal, or columnar. On surface view, cells are seen as polygonal or irregular in shape. Cells are seen as polygonal or irregular in shape. Now, surface of the epithelium. Now, this is the apical surface. Surface of the epithelium. This is the lateral surface, this is the apical surface, this is the basal surface, this is the basal lamina. Okay, this is basal lamina. Now, basal surface remains in contact with basal lamina or deeper cells of the epithelium. Apical surface of the epithelium cell faces external environment in skin or luminal content in the tubular structures or may be attached with superficial epithelial cells. Lateral surfaces of the epithelial cells are junctional complexes with adjacent epithelial cells. Now, one cell and another cell laterally. The basal lamina and the basal surface. Now, apical surface, it secretes mucus or whatever component of that specific organ. Now, classification of epithelia. Layers of epithelium. Layers of epithelial cells. Shape of cells facing towards free surface of epithelium. Simple epithelium, one layer of cells. Stratified epithelium, two or more layers of cells. It is one layer. Okay, this is. Now stratified, two or more layers. Like this. We will see in the slide and the histology textbook like this. And pseudo means stratified like this. It is stratified in pseudo-stratified, and it will depict. It is a pseudo means false. Okay. Now, classification of epithelium. Now, these are the things why I am telling you around 20 marks in histology. But histology portion, আমি 20 marks বললাম, 20 marks এর মধ্যে তুমি 5 mark গোল্লা পেলে, you get 0, but 15 marks solid. তোমাকে একটা concept, you have to build up a concept. This line, all organs are lined by epithelium. তোমার কিছুই ভটকাতে আসছে না, nothing is, you start, but this will be in MCQ, this will be in the practicals, this will be in theory. So it will be 5, 10, like that. Yeah, I'm saying 15 marks. So 15 marks, out of 15 marks, if you get 12, then see one thing what has happened previous years. They have written their past. Theoretical, they have passed. This is, it's quite difficult. Okay. But practicals, they fail. Tauki, 10 marks. 15 marks. So this will be your reserve bank. IMF, International Monetary Fund. Now that inputs in. So it is a small domain. It is easy to grasp. It is not very complicated. You think it is complicated, then it's not. And your distribution of marks is such that it is easy to pass. Before we had dissections, but nowadays dissected body will be prosected body will be there, you will be labeled the liver, potapetes level, your sartorius muscle, like this. You have to just answer, verbally when you communicate. When you first meeting your premika, so dujanai nervous. Valentine's Day, you are meeting in a place. Both are nervous. So it is like this. You're adult enough, you become a doctor. I speak in this language. One of my MBBS teachers, Professor Nitai Chakraborty, he used to joke, he used to do many things, and very simple man, but तो कुछ तो हम लोग inherit करेंगे ना. Now I am a cocktail. Okay. Though I don't drink. I do Kali Puja, but I don't drink. I have no substance abuse. So now see, simple epithelium, single layer thick, simple squamous epithelium, simple cuboidal epithelium, simple columnar epithelium. Epithelium, pseudostratified columnar epithelium, stratified epithelium, multilayered, and transitional epithelium. Keratinized, stratified squamous epithelium, non-keratinized, stratified squamous epithelium, stratified cuboidal, stratified columnar epithelium. Now this, you have this flow chart in every textbook is there. You draw and make a mistake. What I want to say, this from there you are released from the lecture theatre. Now 11:30 you come, and the slide or whatever will be taught to you. Just have a look through, see through. And previous night also you see through today's whatever being taught to you. Just read, just go through it, that. It doesn't sound French or Chinese to you. So it becomes, you pick up very fast. You don't think it's so vast. क्या करेंगे? अरे हम लोग तो करके चला है. हाँ, शुश्रुत 2000 years उसका descendant the Ayurveda doctors. Okay, my great grandfather, my grandfather, my father, and myself. My younger daughter is a dentist. Okay, now we have all gone through. Panic to tha hi. Okay, now but you are privileged in the sense you are having. I told you again. যে স্লাইড দেখছো তো স্লাইডটাই দেখো, তখন তুমি হিস্টোলজি টেক্সট বইটা পাশে রাখো, একটা খাতা রাখো, যে ওখানে একটা দুটো স্ক্রিবল করে দাও. You just draw, scribble, and go give it to your next friend. Leave the microscope. Sit aside or you come to this class. No. But what is happening? You're carrying your bag, moving on. একটু দেখে নিলে তুমি চলে যাবে. I just repeated the same thing. I won't, just to stress. Now, simple epithelium, single layer of cells resting on basal lamina, classified into 3 groups of shapes. Simple squamous epithelium composed of flat cells, simple cuboidal epithelium, simple columnar epithelium composed of cells more than height than width. Now, please, you come, 10 of you or 5 of you, whatever it is, you come, see the thing, come back, and then 11:58, 12, say half an hour or 15 minutes, 20 minutes you'll be there, then you pack up and move. But see each day, each slide, each class, you don't miss. Either it is my class or anyone's class, the different batches I'm telling you. At the end of the year, you will come and say, Dekha hoyni, I have not seen this slide. You cannot blame us. And in the thing, in the histology room, there are beautiful pictures of the histological section, but that is not HNE stained. That is special stains are there. Few are HNE stained. But whatever it is that, what is pertaining to your syllabus, that is there. That can be depicted, and also you can apply your common sense, and accordingly your histology textbook is there, which is HNE stained, most of them. You see them and then you correlate. It is a mastery you have to do, adapt for correlation of each matter. Like you see, why I'm telling you your Hrithik Roshan's biceps. It is not, the lighting is a bit disturbing. The light is disturbing. Now, what is this is a simple columnar epithelium. And what I want to demonstrate just now is that you have one notebook with you. Histology. আজকে ধরো lecture class, homework class, physiology class, no. You carry morning practicals, the book which is concerned with practicals. Histology is going on now, so histology, you carry a histology book. You carry your one notebook, not diary or something fashionable notebooks and all, because you need bundles. So what you have to do is that you have your atlas. This will have, see, a drawn picture. These are all drawn pictures, but the textbooks you are having, see, this is the micrograph, photo micrograph. It's the photograph taken from under the microscope. Okay, now similarly, what is the simple epithelium and all, you read today, you put it, you buy, you have bought these 7 days, I'm telling you. What you do, the epithelium, muscle tissue and microscope. Don't go home. एग्जाम हो गया, इधर इस लोग का एग्जाम है, आप छुट्टी जाएंगे. Don't, I'm telling you, don't. You have to go up after you give a first this thing or whatever exams or internal assessment or anything. Then you go home because you are having abundant trains for North Bengal. And those are from North Bengal. You suddenly get a Vande Bharat and you go and return after 3 days. Don't, because I'm telling you, you don't. It will disturb your studies. And then at the end of the year, you will be crying and telling your mother and father will come down and produce some medical certificate and all this. Don't ever call your parents, call them on a holiday, call them on some occasion or in Santiniketan Utsav. But every weekend and this thing, going to Calcutta, Santiniketan Express, coming, journey and this hot, you spend here. Relax, study. You take my advice. I'm telling you, first 2 years I never came home, except some in a month once or twice Sundays. Okay, one thing I tell you, what you have to do is that whatever slide, whatever microscopic slide is there, you put it here, and you. This is there, it's all right. Now this stage you put in the lowest, in the bottom. Okay, now at this stage you take, you first view 10x. 10x. Now you can see the whole, see if it is a slide like this, your tissue is here. Then 10x, what you will see most of it, section. Okay. Now what you do, you slowly, you 10x you view, you see, and then slowly, you adjust the fine adjustment and you lift up your stage like this. And you see it doesn't bang. Mata thukana, it crack. ঠিক আছে? এটা আমার ভালোবাসার sign. Now you see like this, you just go up. See, it will stop. It won't break. Now what you do is that you view. This is a binocular microscope. Okay, these the optics, this is your eyepiece, this is the stage, and this is you bring forward to this thing. Now, what I'm telling you is now in 10x, you will be see, you can draw like this. This is a muscle layer. Okay. Now you can see it's the epithelium. Now it is a stomach transverse section. Now naturally I'm saying from here. Okay, this is the inner layer, epithelial layer. Now each cells are there. These are the cells. These are the cells. These are the cells. Okay. Now it is lying on the basement membrane. Now this is not single epithelium. The folds in folds in folds in folds in folds. This is having like this. This is having like this. This is having like this. This is having like. These are the cells. Okay. And This section is like this, it's placed in 10x. You first view in 10x, and what I'm telling you, you have your atlas or your histology textbook on the left side. You have a notebook dedicated to only your histology. Actually, what I'm telling you, histology. When you are revising, that will be your revision note plus your this thing, plus the practical khata. You these examination days, you draw the microscope, you draw the first few epithelium, around 10 slides you can complete in this holiday, okay, examination period. So don't go home. You came just now, okay, and when you have a genuine holiday, you can go. যে কটা ফার্স্ট 10 পেজেস মাইক্রোস্কোপ এগুলো সব এই 5 দিনের ড্রয়িং ফ্রয়িং করে কমপ্লিট করে সাইন করিয়ে নেবে। নেক্সট উইকে তোমরা যখন আসবে ক্লাসে সাইন করে নেবে। তো এটা আজকে ডেমনস্ট্রেট করে দিলাম। নেক্সট ডে আর একটু তোর মাইক্রোস্কোপগুলো যেগুলো খুব ইয়ে আছে এক্সামিনেশন জন্য রাখা আছে, তাই জন্য ওটা আমরা দেখাবো তোমাকে। আর আমি যে পদ্ধতিটা বলছি, এটা পদ্ধতিটা যেটা বলছি এইভাবে করো।